Welcome to tonight's webinar. We're going to be talking about increasing practice efficiency by fully utilizing your dental auxiliaries. Should be a interesting and educational event here this evening. We're going to be stepping through a couple different sections here. Deb's going to be telling us all about how to really engage auxiliaries so that your office can be a happier place, and then planning to make your office more efficient and not just kind of winging it day by day. She's going to walk us through some of the common procedures that are excellent candidates to assign to your auxiliaries. I'd like to introduce you to Deb Kaiser, who just started with Garrison Dental not too long ago. How long have you been with us now?
About 2.5 months.
2.5 months, and boy, what a lucky catch for us. You know, we've got somebody here that is well versed in the dental industry. She's an account executive with us, and I'm jealous a little bit of her customers because she's got such a wealth of expertise to bring to our organization. So she's well qualified. AFTA program coordinator at Stark State College in Ohio. She's been an adjunct professor at Grand Rapids Community College, more than 20 years in private practice. So without any further ado, I'm going to go ahead and turn things over to Deb.
All right, thanks, Kevin. I just want to get started by saying there's a lot of ways you can benefit your practice by utilizing your dental auxiliaries. And one of the main focus for me is an employee's longevity in your practice. And most docs like their employees to be around a long time, and the benefits of that is if you give them more responsibilities and duties, they actually like to contribute, and it makes a big difference in their being engaged in your office. And reports show that the more they're engaged, the better they feel about themselves, and they report back they have better job satisfaction, and which goes along with increased efficiency. The more they do, the more your office is effectively scheduling, utilizing their skill set, and then your production, you will see definite increased production. I'm all about letting your dental auxiliary do as much as the law allows. But in the United States, there are so many different laws. Each state has its own set of requirements. And here's a website that you can have your dental auxiliary log into to see what your state requirements, what they're allowed to do, because we really don't want to advise anything that's not within the statutes of the law.
So, quick question for you, Deb. In your time in Ohio and then here in Michigan, just kind of an off-the-cuff guess, what percentage of the EFTAs that you dealt with were in fact being fully utilized in their practices?
I would say in Ohio, it all depends on the practice. The doctor really does set the pace for his own office. So it really depends on the doctor himself. I know that probably no office fully utilizes an EFTA within the restraints of the law, but it really is customized because there are some docs that really feel they don't want to release the reins, and there's some docs that come right out of school that they're used to having somebody help them or having an assistant do a lot, so they're more apt to release the reins a little bit. But it really is personal choice per doctor.
So you're saying that chances are that even if they think they're really maximizing their EFTAs, there may be some steps that they're still missing that they could turn over.
Absolutely. They're a little bit, as far as having efficiency increased, is going to go a long way. So I absolutely think they're totally underutilized overall. All right, and how do we get started in the process of utilization? First, if you don't already do a monthly staff meeting, I suggest that you start, because it really does keep everybody in the practice on the same page. And to get started, I would initiate a goal or a conversation with your staff and let them know, hey, you have some ideas, you want to become more efficient, and let them know what your goals, what you're trying to reach, so that everybody can come to that meeting prepared. You should have everybody bring 2 ideas to the table of how they think your office, as far as clinical procedures go, could be more efficient. But then not only 2 ways to 2 ideas, but then 3 solutions per idea of ways that they think they could increase their efficiency.
So not just come with, I think we can do this, but here's how.
Right. They have to have 2 ideas and then 3 solutions to each idea, because, I'm all for being efficient even when it comes to staff meetings. Next would be communication. You have to have a game plan of what you personally in your office protocol, what you want to accomplish as far as efficiency. What procedures picking out are you going to try to utilize? And then you should always identify a team member, depending on the size of your office, whether it's 1 team member or 2 team members, to help you implement, convey, communicate, because you as the doctor, you don't have enough time in your day to get everything done that you need done, so you're going to have to just identify a couple team members to help you put these changes in place and implement new procedures. And then it's all about the follow through. You want to make sure that it's observe and correct, because nothing is perfect, nothing goes as smooth as you would hope. So it's always about observe and correct. Have that implementation leader note suggestions along the way. And I always recommend that you only start implementing 2 or 3 changes over a 6-month period of time. That way it allows for the influx of observe and correct. You want to make sure that you have time to see the changes and note that if it's a successful change for you.
And not throw too much
Exactly.
Against the wall at one time, or nothing's going to stick. So.
Right. You definitely want to fine tune and make sure that it's a success for your office. Another suggestion, as far as increased awareness helps with efficiency, is you really want to break it down. You want to break down your schedule into fine details, and you should always plan ahead. Look 1 week out if you're not already doing so. Look at the schedule for procedures. Look for something that the schedule might not be accommodating your staff. What if there's somebody on vacation? Or just look for things 1 week out. If you do implants in your office, do you have the right implants? Do you have the right crown and bridge? If you do E4D or CAD/CAM crown and bridge in your office, do you have the appropriate stock of whatever you need to do? Look 1 week out for things that you might need to order or plan ahead for.
So is that like a rolling week out? So let's say it's Tuesday morning. You would look at next week Tuesday. You're not looking at the whole.
Nope, you just look at that single day. That is
like
correct.
A rolling 1 week. Okay.
And then also have your staff look 3 days out for people that might need pre-medication, staff coverage if somebody knows they're going to be out. They normally would know 3 days ahead of time. Lab cases, normally if you're going to have that lab case in, and if you're not, that's a great time to change the schedule. That way your front desk person can fill in and make sure you are scheduling for production. And then we would go to the morning huddle. And things you should try to accomplish if you don't already have a morning huddle, you should consider it. And each person should only take 1 to 2 minutes on that morning huddle. You should be going over the treatment for that person, any special needs for that person. Also discuss outstanding family treatment, because it is all about being efficient and getting people scheduled. Some offices like to plan ahead to do invites. They want their practice to grow, so they look at the schedule. They know which candidates would be good for people to do invites for that day in the schedule. So you would identify those.
Describe to me I'm not familiar with the term invite. So tell me what are you inviting the patient to do?
You would just look at people that are in good standing with your practice, and you would want to grow your practice with more people like them. So for example, you would say, hello, Mrs. Jones, I know you are one of our valued patients, and we would love our practice to have more people like you here. We don't know if you have any neighbors or friends that you know that would appreciate good dentistry, and we are the most compliment we can have from you is to refer your friends, family, your neighbors.
Okay.
Something along those lines. And then you just make sure everything's noted on the schedule, because if it's not written, then we might forget to ask that person. So it does help the staff remember to do that.
Would you potentially at that time make any notes as far as recommending to certain patients of bleaching or additional services?
Absolutely, that would be something else if your practice has bleaching or doesn't recommends toothbrushes or has specialty products. Even maybe the office does Invisalign if they're a general dentist that does Invisalign. That is something else you would note on the schedule that you knew that patient had asked in the past about, or that you would recommend the new products. And as far as daily duties, that is just something that, look at the schedule. If there's something that is out of the ordinary, or somebody calls off sick, or there's weather concerns, you just want to make sure you address anything that changes for those daily duties. We all know that there are unusual events or predictable procedures. Unusual events are like behavior issues. If you have a child in the chair, you can't predict if they're going to misbehave or not. Equipment failure, occasionally something might break, you can't predict that. And then dental emergencies, somebody comes in with, they accidentally broke number 8 off playing basketball or whatever. Can't predict those either. But the predictable procedures is where I want to concentrate focus on, where you can increase efficiency in your office, like restorative procedures when they're getting numb. There's ample time for your dental auxiliaries to be efficient there. When you're prepping a tooth, there's an empty room or a staff member that can be efficient. Predictable procedures is how long it takes you to turn over a room, how long it takes the doctor to do an exam. So those are all predictable procedures as far as things you can plan around and utilize your dental auxiliary. I just had a sample office. Some offices are set up a little differently, but a lot of offices have 3 doctor operatories, 2 hygiene operatories, and it's just broken down. And this is just a guesstimate. Obviously, every doctor takes a little bit different time to do an exam and treatment plan, but you can see it really doesn't leave, it leaves 44 minutes an hour to do dentistry, and that's not including turnover time and numbing time. So when you actually break it down dentistry-wise, the dentist has very little time to accomplish what they need to accomplish in an hour's time. So that's why I want to relay how we can help the office be more efficient.
Sure.
And doctors, operatories 1 and 2, they schedule root canals, crown and bridge extractions, and restorative. So the dentist is always bouncing back and forth between his 2 ops, and a sample would be the 3rd operatory would be utilized almost exclusively by the dental auxiliary. They would be diagnosing emergencies, doing impressions, doing bleaching and sealants, doing denture adjusts and full mouth series x-rays while they're waiting for the person to get numb in another room. So there's a lot of ways to utilize that 3rd operatory. We're going to get into the heart of utilizing your dental auxiliary. Normally a dentist would have 2 assistants, sometimes 3. So we always try to utilize 1 as a hygiene assistant. So if the hygienist is running behind, or depending on how efficient your hygienist is, the dental auxiliary can turn over the room, seat the patient, get the x-rays for the hygienist, and then when the hygienist comes in the room, they can help her perio chart. And then before the hygienist is done, if needed, do a full mouth series in a different room, if you utilize a pan and 4 bite wings, they can help the hygienist and then turn over her room when she's done. And also, if the patient is getting numb and you don't, depending, it's every 5 years, the insurance will allow you to take a new full mouth series x-rays. So if they're in the doctor operatory for a procedure, you can schedule your dental auxiliary to do a full mouth series if you feel they need it. Also in the hygiene room, while the parent could be in the next operatory and the child could be seen in another hygiene room, if there's sealants needed, normally it just takes your dental auxiliary 5 to 7 minutes to place a few sealants. I'm not talking 8 sealants, I'm talking a couple sealants, maybe 2 quadrants of sealants. You can utilize them same day. The mom is thrilled, she doesn't have to bring the child back, and then it does increase production and efficiency in your office.
So keep an eye out for when there's multiple persons from one family walking in the door.
Absolutely, absolutely. That would definitely help, and the parents would love that, not to have to bring the child back. Sectional matrices, this is something that you really don't think about that does save, 3 to 5 minutes putting on the sectional matrices. The doctor can prep the tooth, like always, step out of the room, either numb another patient up or go do a couple hygiene patients, and the dental auxiliary can etch, prime, bond, apply the sectional matrices. Most states do allow the dental auxiliaries to place the matrices. I would always recommend that you have your dental auxiliary practice either on a typodont or on another staff member before having them start doing new procedures on patients, though. That's something I strongly and highly recommend, that even if you don't have a typodont, you can cut a plaster model and have them practice putting sectional matrices on, or whatever procedure you're going to ask them to do. And then, of course, you always have staff as a guinea pig to allow them to practice procedures. And then while the person's getting numb, we already talked about introducing new products and procedures in your office. If you just started offering Invisalign, while the person's getting numb, they pretty much have, you have their undivided attention.
They're trapped, so
they're trapped. So you can go over new procedures, new products with them. Also, you can go over, post-op instructions, save time on the end of the appointment just by covering those post-op instructions. Something that dental auxiliaries are allowed to do is smooth polish restoration. So if your state doesn't allow the dental auxiliary to place a restoration, they possibly could be allowed to do the finishing and polishing. So
that's another case where they want to double check that website to make sure that that's allowed.
Right, exactly. And it could save 5 to 10 minutes on the doctor's schedule to have them finish, polish, check with floss, and check the occlusion on the ending of that appointment. So that was just something people don't think about on the downside of appointments, how to save time. And then with Crown and Bridge, another way is doctors don't think about having the dental auxiliary pack cord. Well, a lot of states let you, and some states don't, because the cord has epinephrine on it.
Sure.
And so if your state allows them to pack cord only if you don't have the epinephrine in it, then you could buy the epinephrine-free cord and get away and have your dental auxiliary pack the cord. Again, the dentist can step out of the room, do hygiene checks, numb another patient up, or return a phone call, and the dental auxiliary could be packing that cord, getting ready for the impression for Crown and Bridge. So another way to save time.
Sure.
Utilizing your dental auxiliary. Next, we're going to start demonstrating some of these procedures. Like I had mentioned before, you always want to make sure that your staff member practices on a typodont or a staff member as a guinea pig before they actually start working on patients. Is a dental EFTA, I always recommend examine the prep, because Even if you're sitting chair side as the assistant, you can't see as well as when you're behind the patient and placing the restoration. So something with composite, you know you don't have to be as aggressive with the prep. So I would suggest that you'll always see if the contact is broke or if you need to pre-wedge. So Garrison does have these fancy, one of our best sellers now, they have the little fins on them. They're the new fusion wedge. And if the contact wasn't broke, I always suggest that you pre-wedge and then slide the band or sectional band on here and then remove your wedge after the band is started. That way, if you have a conservative prep, and you can see we have our matrices interproximal, and something else you want to suggest to your staff member is make sure that it slides down under the gum tissue, because you want to make sure that it doesn't slice the patient's gum tissue. So all these little tips of making sure that the matrices is properly applied. And I'm just trying to get this to kind of go down under the gum tissue. Even though this is a typodont, it's kind of hard to have it go under the tissue. And then you want to pick the size, appropriate size wedge, because the wedge's job is to just hold the band against the tooth. It is not designed to separate the tooth like in when you use a Tolfemeyer, the wedge was designed to separate, but when you use sectional matrices, it's designed to hold the band against the tooth and not separate, because when you use the rings are what separates the tooth and allows for that good contact. And Garrison does have these new fusion rings, and this is the tall ring used for a molar, and I suggest that you come in at a 45-degree angle and you push the tines against the band and then drop it directly on that wedge, because you don't want to crinkle the wedge. Couple things as a dental auxiliary you want to look at before you place your restoration. You want to make sure that this band, I'm going to tip this up a little bit here.
Zoom in just a little bit for you too.
Okay. You want to make sure that this matrices is at least 1 millimeter higher than the prep, because you don't want to end up with an open margin. So you're going to identify that the band is indeed over the margin all the way around. And the other thing is you want to look down in this box and you want to make sure that there's a tight fit here, because that's what's going to keep no overhangs, and is going to you're not going to have to do a lot of finishing, because you're not going to have any excess interproximally. And then the last thing, and this is personal preference, we do have the pull tab here on this new fusion matrices, but I like to just slightly push this matrices over on the tooth, because it allows you to build the restoration to the exact height of the adjacent tooth. So when you're contouring, now you see this little bend, you know it's the marginal ridge of the tooth in front of it, so you're actually going to spend less time finishing and polishing, because you just have this little visual landmark of how high that restoration is going to be. So just a couple of tips on sectional matrices and what your dental auxiliary should be looking for when they place the sectional matrix bands. Another product is the Fit Strip, and what it is it's a interproximal reduction on a handle, and you can kind of see it is on a handle. The handle actually is removable, and you would use this without the handle on the posterior teeth, but with a handle it kind of allows you to see exactly what you're doing when you're smoothing and polishing an overhang. So if we look at this lower anterior, if this had an overhang here and we needed to smooth and polish it, that would be something that a dental auxiliary could do. And with these fit strips is you always want to start it in this straight position, because this actually is, if you twist the barrel, it's going to contour and go exactly where you need it as far as interproximal against the tooth.
So when you're first getting that interproximal, you want to make sure it's straight.
Exactly.
Okay.
And you always want to start with the fine and then move to the coarse. So this is the super fine, and you can see I'm starting with it straight. And once I get it to where an overhang would be, I'm going to turn the barrel, and it's actually going to contour to the shape of the tooth. I don't know if you can see how it actually does contour. Yeah. And then with a handle on it, you can actually visually see better, and your fingers are not in the way. And so then you would just slightly do a little bit of smoothing and polishing, get rid of that overhang, and then you would definitely want to straighten it back up till it was in the straight position and remove that. And then you would just double check with some floss to make sure that you didn't have an interproximal overhang. Something else these fit strips are good for are interproximal reduction, but since it's tooth structure, that is something that's only allowed to be done by the dentist. Dental auxiliaries are not allowed to
Okay, so that's kind
remove.
of the delineation there. So if
Right.
you're on virgin tooth structure, it's got to be the doctor, and if it's on material that has been placed, then it frees up some.
Right,
Okay.
right. So, if you have Invisalign or do any kind of IPR, that would be a doctor responsibility only. Something else that dental auxiliary can do is pack cord, and this is one of these fine and dandy Garrison instruments. It's a double-ended cord packer. And it really does come in handy because it really, you just flip it around and you don't have to do a lot of movements. Some things you want to make sure when you're packing cord is I always like to give it an extra little twist, because once you cut it off, they do seem to come unbraided. And you want to make sure that you have the right size, nothing like getting the cord packed and having it be just a little bit short. So I recommend that you always kind of give it a quick once over to make sure that you have enough cord that you're not going to run short. And then you should, as far as dental auxiliaries, should always make sure that when you start packing the cord, you don't start interproximally. So you should start on the lingual, so that when you end, you're also going to come down to the lingual. And
I can see where this in particular would be a great benefit. Doctor cuts the crown prep, make sure that the crown prep is looking the way that he or she wants, steps off, goes and does whatever he or she needs to do, and the assistant packs the cord, takes the impressions. The doctor can come back in, check the impressions, make sure that that they got everything that they needed to, and without having to do some of this tedious stuff.
That is correct. And if you have one of the E4D scanners, they pack the cord. Some doctors like just to double check the cord to make sure that it is that they can see the prep, but if not, then the dental auxiliary can indeed go ahead and do the scanning, get that impression. Different laws, sometimes you have to have the doctor come in and do the impression because it is considered a type of final impression. So depending on the different laws, the doctor, after the cord is packed, comes back in and double checks everything and does do the impression themselves. But as you can see, this instrument is great for just flipping it around and getting it.
It's not easy to pack cord on a type
It
with
is
those
not.
rubber with that rubber gingiva on there. That is a trick. I am not able to do that.
And the other thing is, normally you have a lip underneath the crown prep, and this instrument is great. Is you just take it and roll it underneath that lip, and if it was a real person, the cord does definitely stay down underneath that lip of the prep, and it's just you pack and roll, and it does stay down underneath. So it's a great way to utilize this double-ended cord packer here.
Now, Deb, what's your take on magnification for the dental assistant?
I definitely recommend it because everything is pretty tedious. I used magnification when I worked in private practice, and then I felt I couldn't see unless I had them on. So, it's a dark place when you're working in somebody's mouth, and to have magnification and even a light on the magnification really does help, because you want to be as efficient and do excellent dentistry, and you don't want to do it in the dark, and you want to be able to see as best as possible. So I definitely recommend that you utilize magnification, because the mouth, there's definitely small spaces
Yeah,
and not
yeah.
enough light.
So,
And then the final thing I want to demonstrate or talk about is polishers. We're not really going to demonstrate, we're just going to talk about rally polishers. A lot of states, the dental auxiliary is allowed to do the finishing and polishing of composite restorations and polishing and finishing after the crown is seated. So we do something that's going to save you time and energy is after you place a restoration, if your EFTA is not allowed to do that, step out of the room, let your dental auxiliary smooth, polish, check the bite, check the floss, go over post-op instructions while you move on to hygiene checks or the next room, numbing somebody up. And as far as crown and bridge, we do have a polisher kit, same type of thing. You can seat the crown, let your dental auxiliary clean up the cement, and if the contact is blocked with cement, they can use the fit strip to, again, go in and clear the contact with the fit strip, use the contour on that to get any excess cement off, and then go in with these finishers and polishers to adjust the bite and make sure that that crown is smooth with any adjustments.
I'm sure one of the things that a dental assistant auxiliary would appreciate is with the rally that it can be used as a single use and disposed of, so they don't have to mess around reprocessing. So.
And absolutely, and you don't need any paste on these rally polishers. So the mess of them spinning the paste all over the place, so it's a lot less mess on those finishers and polishers of the rally. And another thing is, if you barely touch a tooth with the rally, if you barely touch it, it is fully autoclavable and you can reuse them. So you don't have to throw them away just because you touch somebody's tooth with them. You can autoclave those.
You can keep them going. So.
Absolutely. Along the communication lines, all offices, we hate to say that we have cancellations or sometimes the schedule has changes. But not many doctors or dentists think, okay, how can I best utilize an unforeseen cancellation? And that is something you should try to plan, ahead of time for, and just communicate with your staff member. Okay, our cutoff is if the cancellation is 10 minutes or more, because everybody needs a breather. If it's less than 10 minutes, it gives staff members time to get a drink of coffee, take a break. But, decide what your cutoff time limit is. If it's 10 minutes or more, then just have a schedule posted. Okay, this is what, because it needs to be visual. You could say, I want everybody to go through and check to see if the anesthetic is expired. But unless it's right in front of you, you forget. You just go, oh, I know there's 10 things I need to do, but I can't right now remember any of them.
So if you're at some point in time you're going to have time.
Correct.
Through cancellation or some other activity is going to wrap up early. So planning that time can really help out.
Exactly. Like look for schedule changes for the next day or a couple days out and see what you can work into the schedule. But communicate downtime. Know your office. Know what's most important to you. If the lab work and getting the lab work done and on time is a high priority, if you're a busy office that does a lot of lab work, maybe that's priority one. But it just helps your dental auxiliaries, your staff member knows what their responsibilities are. We're all adults. We all know we have certain responsibilities, and it helps them feel like they've accomplished something, and it allows the doctor not to feel like they have to police their staff either. So it's a win-win. Utilize and plan out cancellation times. We all hope we don't have cancellations, but not many offices plan what
to do.
right,
Sure.
what responsibilities
I
are.
can see that being a pretty big hole that is just begging to have a plan ready for it so that you can make sure that things are moving as smoothly as possible.
Going back to having a happy office is everybody likes to make a difference and contribute, and that really helps the employees stay engaged and stay focused. And studies show that if somebody's engaged and focused, they're going to be happier, and the mood, the energy in that office is definitely going to be noticeable by the patients. Dale Carnegie Institute research says business improves when staff is engaged. That is true. And happiness leads to loyal, productive quality and profits for the staff. I mean, happiness, your dental auxiliaries want to be there. They're going to be loyal to you. They're going to say, this is the best place to work. Don't want to be anywhere else. And patients probably aren't going to remember what you said or very little of what you said, but they are definitely going to remember how they felt in your office. Do they feel comfortable? Do they feel your staff is engaged? Do they feel your staff wants to be there? Are people grumpy and complaining?
Yeah.
You know what I mean? They pick up on all.
Yeah.
They overhear a lot of things too. You might be thinking.
Yeah, I could see that where staff is chatting and they don't realize that the people in the operatories are perfectly capable of hearing everything that's said.
That's right. And so, happiness is infectious. Enthusiasm definitely goes a long way, and it's very good for business. Turnover is bad. Obviously, it costs you money. You have to recruit new people that you think would be a good fit. You need to train them. You might have to forego some appointments because you don't have staff to cover those rooms. And so that's going to hurt your bottom line. It also hurts morale for both employees and patients. Your patients get used to seeing certain faces in your office, and when they're no longer
what happened to Mary?
there,
Where'd
right?
Mary go?
So it just overall, if you can keep your employees happy and engaged, gives them job satisfaction too, where they're contributing. They will like to be there long term. Longevity of an employee is going to be noticeable to your patients. Staff likes to be engaged, which leads to job satisfaction, which, if you allow and share the responsibilities and duties, it's going to allow them to feel satisfied that they're contributing. It's going to increase your efficiency, like we went over, which is in turn, you're going to be able to schedule a little differently, cut down some of the doctor time, and he'll be able to increase his production. And we always recommend that you share the wealth back with your staff. When you do your staff meetings, have a bonus box. Have something where everybody contributes little things that they've noticed another employee do, or even the doctor does. What if the doctor made a big difference to a patient or somebody else? We always say drop a note in that box and share the wealth of positivity, or make smoothies for everybody, or order out smoothies or pizza, or just do little things that say, wow, your staff is appreciated. But not only that, like I said, the bonus box can be your staff notices what an awesome doctor, what an awesome office they work at. So it does go both ways, and I just, suggest at your monthly meeting,
It's sometimes when you're put on the spot too, it might be hard to remember some of these little things that occurred over the course of the month, and if you drop just a quick note in there, you've got it right there, at the end of the month, and you can say, oh yeah, now I remember that, Joni did this and the patient really appreciated it, or something.
And we don't always hear in the back as clinical staff, but they make it to the front desk, and they might say, wow, that appointment went really smooth, or gosh, I love these veneers the doctor did, or, they hear a lot more feedback at the front desk, and so it's a great opportunity for the front office to drop those notes in about the staff, or if there's, unfortunately, if there's something that comes up that wasn't so friendly, they can also, they get that feedback too.
Thank you very much for joining us.
Thank you.